Hi, this is Dr. Padma Garvey. I have a little bit of a cold today, so please excuse my scratchy voice. Today I'm going to talk about the conspicuous lack of nutrition education in U.S. medical schools. And you might ask why that is, and what I'll say is follow the money to understand why doctors are not taught nutrition in America. While passing through my waiting room on my way to my office a few days ago, I noticed a magazine on the table. It was one of hundreds of such magazines that I've seen in our offices, in many doctors' offices. They all have them in their waiting rooms. And given my field, the magazines in my office are usually about pregnancy and women's health issues. There's usually a picture of a beautiful, smiling pregnant woman who's physically fit somewhere along in her third trimester, and she exudes the picture of health. Invariably, there are articles written by MDs, midwives, and nutritionists talking about things you, the patient, can do to have a healthy baby. At first glance, the articles appear to be well-written, helpful, thorough, and unbiased. However, if you look closely, you realize that the entire magazine is an advertisement for baby formula, prenatal vitamins, and other such things. So let's take folic acid, for example, because this was the article that caught my attention most recently and inspired this podcast. The article stated that studies have shown that adequate folic acid before pregnancy and during pregnancy help to prevent developmental problems in babies. The article also mentioned that studies showed that a minimum of 400 micrograms a day of folic acid was necessary. And the article encouraged women to check their bottle of prenatal vitamins to make sure it had an adequate amount of folic acid in it. Now, at first glance, this all seems harmless, but there are several problems with this article. First, the article fails to mention that all the initial groundbreaking research that demonstrated a clear association between adequate folic acid levels and prevention of neural tube defects were done on patients eating a diet rich in folic acid, not on patients taking a folic acid supplementation. Further studies were done, and these studies were sponsored by pharmaceutical companies, and they duplicated the initial studies' results using their supplements. Second, the article fails to mention that the benefits of folic acid in preventing neural tube defects disappear after 10 weeks of pregnancy because by this point the neural tube has closed. Now, I'm not suggesting that a woman shouldn't keep eating a folic acid rich diet throughout pregnancy, but the actual prevention of the defect ends after 10 weeks of pregnancy. Third, the article didn't mention any foods that might provide folic acid and goes so far as to imply that you can only get this through your prenatal vitamin. Now, never mind that 2 Flintstones chewables have enough folic acid in them. Foods such as leafy green vegetables like spinach, citrus fruits, beans, breads, cereals, rice, pastas, all of these are rich in folic acid. But interestingly, most doctors don't stress this. Most doctors assume that a prenatal vitamin is required because they are getting their nutritional information from the same place the patient is. As a result, the vitamin industry makes billions. And then the latest craze is DHA in brain development. It has led to more and more expensive prenatal vitamins and has increased the devastation of our oceans. Doctors are led down this craze as well because they don't realize you can get DHA through your diet and it can be a plant-based diet that doesn't require destroying the ocean. Now, medical school is rigorous. Subjects covered include anatomy, physiology, cell biology, neuroscience, biochemistry, pathology, and pharmacology, just to name a few. And most medical students in the United States attend 2 hours of pharmacology lectures a day for an entire year of medical school. It may surprise you to learn that only a very, very small number of medical schools in the United States teach any nutrition at all. And even those schools that do spend only about 20 hours on the subject. Medical schools get a lot of money from the food industry, from biotechnology firms, and pharmaceutical companies. They support ongoing research, and the deans and the faculty may be paid consultants for these companies. So there is no desire to teach medical students nutrition whatsoever. If nutrition were taught, then your doctor may feel confident that you can prevent spina bifida by eating a spinach salad and a bowl of lentil soup. Your physician might know that the more natural way of getting folic acid is through that spinach salad and that lentil soup. And your physician may be inclined to say, look, taking a pill isn't the best way to get this folic acid. Your physician would be more confident in telling you that these foods are better for you and your baby than your prenatal vitamin. Instead, doctors leave medical school confident in the power of drugs to do the job and underconfident in the power of unprocessed, low-oil, whole foods. In contrast to U.S. medical schools, Swedish medical schools spend a lot of time on nutrition. And isn't it interesting that Swedish OBGYNs say a healthy, varied, unprocessed diet rich in fruits and vegetables is enough and do not prescribe prenatal vitamins to their patients? While patients don't always listen to their doctors, pregnant women tend to be very receptive to physician advice. Oftentimes, a pregnant woman will stop smoking for her baby, which is a very difficult thing to do. If patients heard a consistent and confident message from their physicians about the power of their diet and how vitamins such as folic acid are more readily absorbed into their bodies when presented in the form of real food and not a pill, they would stop spending ever-increasing amounts of money on the Mercedes-Benz of prenatal vitamins and maybe spend that money on organic produce.